Now when we do these locator fixed prostheses, we have many options. You can do a monolithic zirconia prosthesis, which would increase the cost a little bit compared to other options. You could have a processed acrylic, just like a regular denture, but with a framework, chromium cobalt or whatever the lab would like to use. What we used in this case was the iVotion dent, the all white, like I described, which you'll see. Or you could do a traditional iVotion, which is the milled with the pink and the white. They're very strong, they're monolithic. These don't actually need a reinforcing bar for strength, even though I think you could place one in there. Joe, was that?
Yes.
You can
definitely reinforce it if you want. But
okay, and is that reinforcement put in after the fact, or is it?
Well, it should be designed in, so you would design it, and then when you mill out the iVotion, it's just cemented on top.
Okay. Okay, like a puzzle piece. Okay.
What kind of material is that iVotion? What kind of material is
It's a double cross-linked PMMA.
Is it PMMA?
Yeah, it's very similar to, it is actually Ivoclar's DCL teeth material, so it's the same material that they make the teeth on.
Thank you.
Is that going to be much lighter than a zirconia?
Oh yeah.
Yeah.
Dramatic. Yep.
Yeah.
Yep. Just another corporate slide from Zest. You could have a chromium cobalt base and process teeth onto it with acrylic. There's the monolithic zirconia. And when you're picking up housings, there's different materials that work, cement materials that work better with zirconia and better with acrylic. You can have these polymer bars. BJ, which polymer bars do you have?
Have used Crystal Ultra. We're currently using a Grafanato in it, which is goes by the trade name of G-Cam.
Okay.
You might see that Grafanato.
Okay.
The graphene material is a little bit stronger now than Crystal Ultra.
You could do these in printed resin or Onyx Tough, with or without a framework, and also just a milled PMMA material too. So the possibilities are endless. What you can do, and each lab will probably have their own idea of what would be best, what's strong, what's not strong, what's been working. Okay, so here is the puck after milling that prosthetic. These are the little fingers that are going to help us orientate the prosthesis to the master cast so that the teeth are in the exact position that we set it up and planned it digitally. So these are the seating struts, as I told you. And now we have our master cast. I want those abutments torqued the same on the model as I torque in the mouth. So I torque them to 25 Newton centimeters because this has to be, very, very precise. And then I confirm that the milled prosthetic fits that cast, and there's no space between these struts. And there's some on the lingual, over here. Okay, so without the housings on, this fits perfectly with the teeth in the exact same position. When we process the upper, that bite should just go in the mouth and fit perfectly. Now we're going to add our housings. We're going to block out so that cement doesn't go everywhere with these little white rings. You'll see the little green specks on here. The green specks are because I want to, again, before I put my cement in there, confirm that these housings aren't binding on the integrity of that prosthetic. So I spray with my green spray, occlude, try it in, and I see that it's not going down all the way. So, and this is something, so this is the first one we did. We've learned that we have to make a little more space, and you'll see some of the things that help us, to do this as we go through our other cases. But if I would have just put the cement in and slammed this down, I would have been scrambling to get it off and clean out the cement. So you want to just verify every step along the way. So I go in with my burr, get rid of any little show-through spots. And I think on this, I had to do that like 3 or 4 times before it passively seated with those little fingers touching the master cast. And again, I want you guys to remember, because this I want you to understand is maybe a little less complicated than the traditional screw retain restorations. I was here for a lot of these parts. We were kind of developing this technique, but you don't have to play any part. I mean, these lab technicians are very sharp, and they can do all this for you. You don't have to be there, you know, to do this. But having these struts, as opposed to just going to the mouth and slamming it into place, preserves the occlusion, it preserves the vertical dimension, because if you don't have the struts, it might seat a little deeper, or it might seat a little bit off center. So that's the reason we want this precision. And then once I have it where I think is adjusted, I'll put it back on the articulator against the wax try-in, and I want to make sure my pin is touching that platform, because if it isn't, it might be seated on the model, but maybe the occlusion is a little bit off. And in this case, the pin wasn't touching because I used a little shim stock to see if it was touching, and it pulled right through. So then that told me I'm going to mark the teeth with the articulating paper, and then just adjust these little spots that's holding this up from the pin closing completely. And when you're adjusting this, you're not flattening the teeth out. You're enhancing the enamel. You're creating grooves and ridges and making it, you know, look anatomical. And then lastly, and this is optional, I like to put a hole through the intaglio so that it gives me a little retention, and it also releases a little pressure with the resin that we're picking up. So I'll typically do that. And then another thing that's optional, I like to sandblast the housings just to give a little better retention. This monobond is a bonding agent that works on metal, so it's going to keep these clips from separating, because as you'll see later, when we're taking these prostheses off in hygiene, we're using this pneumatic clip, so we're putting pretty good force on it. So we don't want clips coming out at our hygiene and now we have to go back in and pick them up. So we want to do all the little things we can to make sure that these housings are bonded really good to the prosthetic. So now we have the housings on the master model. We're going to use this Braident material inside of the prosthetic to increase the bond against the prosthesis itself. And then we're going to cement with this Relix Unisem. BJ or Joe, or is this what you guys are still using on a PMMA like this, or?
We have used that, but there is times when we do regular acrylic too, because we have the advantage of being able to put it in the pressure pot.
Okay.
So like a color stable acrylic.
Right. And another thing is, it's a good idea to put undercuts, you know, take a like inverted cone carbide and put some mechanical retention in these housings. I in all honesty am not familiar, like I don't have this in my office.
Oh, okay.
But we could find out the specs, because I'm sure they have this still.
I think that's what it is.
Okay, yeah. Okay, now I'm going to add a little bit of this material to the tops of my housing so I'm not getting any air bubbles. And in hindsight, I think maybe if I was doing this again, I would put it around the sides a little bit more too, into the little undercuts in those housings. Covering all of them. And then I'm going to place it on the model, and then I'm going to place it on the articulator and close my articulator just to make sure everything's lined up exactly how we've checked it throughout the additional steps. And then we can and before that, we'll take some those monobond brushes go underneath where we see any excess material, tease that away, hit it with a light cure. Now, on my lab bench, I wouldn't typically use this tool. You guys are going to get to handle these tools later. I would just take a lab knife and pop these off one by one, but I wanted to demonstrate, because you can see it pretty clearly, at your hygiene appointments, you're going to use this tool. Well, you're going to use it. This tool has two ends to it, and we'll show you shortly. This end is to remove the prosthesis. And so each of these cases has a little cantilever. So you're going to go underneath the very back of one side, and you're going to click that, and it's going to just go pop. It's going to make kind of a loud noise. So you want to tell your patient you're going to hear a noise. Don't worry, it's not going to hurt you. And then you go to the other side, posterior, pop that up, and then you just carry that loop forward to the next implant. Pop, pop, pop. Another one, pop. Sometimes it comes off like in 2 or 3 pops. Sometimes it takes 4 or 5, 4 or 5 pops, depending on the number of implants that you have. Okay, so now here's the intaglio with the black processing spacers that we use to pick it up. Usually there'd be a couple little voids there or a little excess. We'll go in and we'll add any material where there's a little void, where it might be a hygiene problem, and then we'll put it in a light curing machine to give it a really good cure, to really make sure that composite is all the way cured. And now the talented technician is going to go to town, so now they can cut the struts off. Also do a little finishing, make it nice and smooth. And then use some fine discs to enhance the embrasures and the anatomy. And then they're going to do a little shaping of the tissue part, creating a nice finish line where the pink is going to stop. And then she's just outlining just to make sure that everything looks symmetrical. Just showing you this just to appreciate the amount of work that that goes into it. And then what the technician did here also was to create a little finish line so that the pink and the white would come to a 90-degree angle for good cleansability and less bulk. And we don't want the pink on the intaglio because the pink material is more porous. It's more likely to pick up plaque. The milled material is very resistant to penetration of saliva and staining. And then we'll do a final polish. She'll go back in with some fine diamonds to enhance the anatomy. Place a bonding agent so that the pink material will stick to the milled prosthetic. And then there's a series of tubes of this material, this creoline material, that give different features, add depth, give you the attached tissue look. And it really was amazing for me to watch the skill to be able to do this and create such beautiful distinction between the teeth and using these little brushes. And then here's a different material to add the attached tissue, the cervical bulge. And then finally to glaze the whole thing with OptiGlaze so that it's resistant to staining and color change. And here's our final locator fixed. Here's the intaglio on the prosthesis. And our upper denture has now been processed. Different views. Okay, so now we're going to go back to the mouth. She's in this screw-retained prosthesis still, so I got to remove my SRA abutments. I got to place the locators and make sure that I torque it to that 25, so it's exactly the same in the mouth as it was in the model, and that fit is going to be perfect. And now you want to make sure that the lab delivers this to you with the black inserts still in place, because I want to verify with the black inserts that it fits properly before I put the permanent ones in. I also want to be able to adjust the bite if necessary. And if we put if we put the permanent clips in there, and then we have to do a lot of adjustment, or there's something the patient doesn't like, then you got to use the tapper, and it takes a lot more time. So I confirm with my black clips. Once the bite is adjusted and everything's polished, then we're going to change to the permanent processing clips. So this tool, has anybody used this tool yet? This locator tool? This is the greatest tool ever made. So it's got a little end in it that as you turn it, I can't remember if it's clockwise or counterclockwise, this end expands. So you put it in there, you turn the end of it, it grabs that insert, and you just pull it right out. So it takes these out very easily. And then for a 4-implant prosthesis, we're going to use 4 green clips. When there's more implants, we have different colors because the green clips are so retentive. If we had 5 or 6 implants, it might be much more difficult to get the prosthetic off at a hygiene appointment. So when we have 5 implants or 6 implants, as you'll see, well, let's go here. So again, 4 implants, 4 green clips. 5, we have tan clips on the front and the back, and blue clips, inserts. I always say that wrong. Amy would never forgive me if I said that. And then on a 6 implant, again, we have tan inserts in the front and tan inserts in the back and blue in the middle. So when you deliver the prosthetic with the permanent inserts, first you're going to just, with finger pressure, find where those attachments are. You can just kind of move it around and you'll just kind of feel it stop so it's not floating anymore. And then I'll push down with as far as I can with my fingers, and many times you'll hear it click, or it might just seat and stop moving. But it's never down. There's no way you could seat this all the way with just finger pressure alone. You have to use this tool. So the other end of that loop that we use to remove it, you have to unscrew that. This goes on. You'll see these in your kits that you'll use to actually do this individually. And what you do is you go to the back and you do 3 clicks. Click, click, click. It seats that. Then you go to the other side. Click, click, click. And then you go to each implant. Click, click, click until that prosthesis is seated. Then you want to have the patient close and make sure that the bite's right. Take your shim stock. Make sure you're holding in all the places that it was before you put the inserts in. And then you know your prosthesis is in the right spot. There's our final result. Here's our happy patient. We did bring those upper teeth down a little bit to give her a little bit better aesthetics. And this is her, the prosthesis is actually in, and these little extensions you see, like when I saw this x-ray, I'm going, what the heck is that? Well, that's the little retention holes that I drilled to pick up the inserts. And the patient did have the implants, so she's still wearing the denture. These implants were healing. And in the end, she actually ends up losing these 2 implants. And so today she's in a 2-implant upper snap-on type of denture. And we've asked her to put some more implants, and she just thought, I don't want to do it anymore. So There's our happy patient. There's the before and after. And I always like to show a little video.
66, Mississippi. Churches. Judges. Another big smile. Good. Another count to 10.
So what I'm doing when I'm having my try-ins, when I do my final prosthetic, I'm looking to see if my incisal edges are hitting the wet-dry line so that they have a nice crisp F. I'm watching to see that the lower teeth are just missing the upper teeth. We call that the closest speaking space when they're talking, so it's not causing a speech problem. Just evaluating all of the criteria that we use in our basic prosthodontic principles, to make sure that we did a good job.